Hi, can you hear me?
Yes, ma'am, we can.
Okay. I'll just share. Okay, thank you. Thank you for giving me a good opportunity to be a part of the Scleroderma program. And it's a real honor to me. This is the first time I'm joining with you, all of you. After listening to the extensive and wonderful and more informative talk about the scleroderma from rheumatologists and pulmonologists, my talk is basically, it's very basic stuff that what you can do for your skin then hello, can you hear me?
Yes, ma'am. Please go ahead.
Okay, thank you. So it's just the basic stuff, and I wanted to clear a few queries regarding the skincare routine and all. I'm not going very much into the pathophysiology or immunology part or the treatment, that's pharmacological thing. I'm going more with the basic stuff. Okay, so scleroderma is basically, it's a multi-organ disease, which skin is also a part of it. That's why the sclero means heart and derma means skin. And it is not only affecting the skin, but also other internal organs like heart, lung, kidney, and sometimes bone. Basically, because our immune system is overactive, and which can causes a hardening and thickening of the skin. So basically what's happening with our skin is our body will produce a lot of will produce some collagen. It's happened from the birth. So that's why our skin, when the baby skin looks very soft and pliable, but when you go to the 20s, 30s, it becomes a bit firm. So once you reach the 60s and 70s, the collagen starts degrading and your skin starts sagging and all wrinkles starts appearing. But in scleroderma, because of the autoimmunity, body is producing lots and lots of collagen that is not needed. And these collagen get accumulated in the skin. Skin has three layers. The upper part, that is the epidermis, second part is the dermis, and third is the subcutaneous. And mostly the collagen will deposit in the second layer. That's why the skin is getting hardened when you have excessive collagen. So once the collagen starts getting laid on this second part of the skin, that's the dermis, we lose that there will be loss of wrinkles, and that we can followed by the loss of fat. So there will be a change in the facial contour of this patient, and there will be some mask-like fissures. We cannot express it. Sometimes we cannot even close our mouth, and followed by the sometimes drying up the skin and the fissures. And sometimes even if it's happening on the hands, we cannot even close your hands and extend it properly. That all these things happen with this scleroderma because of excessive collagen. So, but every story is unique, like every scleroderma patient. So what's happening? So everyone, almost 80 to 90% patients have some skin changes. Mostly it's the hardening of the skin, the skin thickening. So it might start from the tip of the fingers and it started progressively involving the other areas. Sometimes just only some part of the body, that's morphia. And so when when people have the thickening of skin, it gets dried, your sweat glands will not start working, and there will be associated with the decrease in the oil glands, and you might feel there is a lot of drying effect. And sometimes you can have kind of salt and pepper pigmentation like this kind of depigmentation, and some areas you get pigmentations. And sometimes we can have this digital ulcers because of the Raynaud's phenomena, and it might heal with the scarring, and it might be at that time it will be very, very painful. And sometimes there's a red spots or telangitis. These are the common things what we come across when we are coming across some scleroderma cases. So what we can be done for these things? So skin tightening, first I wanted to talk about the skin tightening. First thing, it is the medicine, either maybe methotrexate or MMF. That is a discussion between your rheumatologist, your dermatologist, and between you. And it depends upon which drug is best for you. And second thing is that we can do some exercises, not like the definitive running or jogging. It's kind of small exercises, like, because usually the tightening mostly affecting this part of the hand. I don't know whether it's possible to see. You can see in the presenter view, it's mostly in this area. So what we can do is simple exercises like moving the hands like this, or using the soft ball, pressing it like that. We can reduce some amount of tightening, and which will give some mobility to your small joints. Second thing, what we can do is, if you have some physiotherapy services nearby your locality, physiotherapist can offer you some wax, warm paraffin wax bath, which will definitely reduces some pain. And after some pain relief, you can simply start some small exercises. And it should be done under the supervision of a physiotherapist. And if that service is not available or not accessible for you, what can we do in our home is just liquid paraffin. That is very commonly available in India. And just apply this liquid paraffin or any oil which is not irritating. Just apply over your hand and just put your hand in the lukewarm water. Just check whether it's just not too warm or too cold. Just lukewarm water. Just dip your hand in that, and just after that, it will give you some pain relief, and you can slowly start your exercise, just movement of these hands. So about the skincare routine in a usual day, I would suggest only the 3 basic things which we should do. The first thing is a good cleanser. Second thing, it's a good moisturizer. Third thing is a good sunscreen. So if you are asking me what is the best moisturizer for me, I don't have any answer for that. There is no best moisturizer. It's what you like the most. Sometimes some people will like more greasier ones because their skin is very flaky or very dry, so they might need more greasier ones. Some doesn't have that problem, so you can go for something which is less greasier ones, like cream or lotion. That will give you that will reduce the dryness of your face. Second thing, you can try lot moisturizer and see which one is best for you. Second thing, it should be, if you are giving me if you want me to give you an overall idea about which moisturizer, I would say better go for a paraffin free, hypoallergic, and fragrance free, because sometimes the fragrance or the parabens, these can cause some allergic reaction to your face or your eyelids, these are the very sensitive areas. So when you apply moisturizer, what you have to do is, before going to the bathing, you just apply good oil, just any oil that's available in your home, like either a liquid paraffin or sometimes a coconut oil or whatever it is available for you. Just apply all over your body, wait for just 10 minutes, then take a lukewarm water or just a hot shower, not very hot, because again, if you're taking the hot shower, it can dry your skin. So just don't take too much time under shower, because if it is more than 5 minutes, again, these hot shower can cause us dryness. And also use some mild soap, because some soaps are having very much alkaline content. These can again dry. Already the skin is dry, so if you use the high alkaline content soap, it can cause dryness in your skin. So once you finish your bath, you can just apply within a seconds. You can apply, there should be some water in your skin, and you can apply this moisturizer. There should be adequate amount of moisturizer. You should not do like take little bit amount of moisture. No, you need to apply lots and lots of moisturizer in your skin just within seconds after your bath. That's very, very important. And it's not only the one time. You can apply twice or thrice, depends upon your convenience, but at least need twice. That will definitely improve your dryness. And sometimes sometimes you have some difficulty in taking this cream and applying over the face because of the tightness of the hand. It may be difficult. In such cases, what we can do is take a good container, and it should be dry and clean. Take adequate amount in that and just apply either with hands if it's possible, or you can use the brush. And when you are applying the moisturizer, it should be in the downward direction, that is towards the direction of your hair, not against the direction of your hair, because if you do the upward movements, it can causes occlusion folliculitis, that is known as hair follicle infection. You might develop some pustules over there, your hairs and all that might then later you might need antibiotics. So better to do in the downward direction. And these are the minimum steps what we needed. First is a cleanser. Cleanser means it is just to clean your face or your body, and it should be something which is mild. It should be, the pH should be at least around like 5.5, not into the alkaline. Alkaline means the pH, if it is in the 7 or 8, which is that's actually alkaline soaps are the most common available soaps in our market. So it is better to use a mild soap or mild cleanser. After that, you can apply the moisturizer. Then you have to apply the sunscreen. The sunscreen, when you are taking a sunscreen, it should be anything, but it should not irritate your skin. That's the most important. And when you are buying a sunscreen, just check sun protection factor, that is SPF. SPF is the sun protection factor. At least it should be 30. So when you're using the 30, it will give you adequate amount of protection. So when to apply sunscreen? So when you're applying sunscreen, it's when you're before going out, just 20 or 30 minutes before going out, you can take an ample amount of sunscreen and apply on your face. That's very important. But will sunscreen give you whole protection? No. Most of the sunscreen will give you the protection up to 2 to 3 hours. So if you are having any sunburn or anything like that, better to reapply after 2 to 3 hours, after 3 to 4 hours. But always, if you are or just taking the shades, this all will give you almost 80 to 90% of protection from skin, protection from sun. Okay, so next question is what about the face serums? Can we apply that? Yes, basically these face serums contain antioxidants. Most of the available face serums are like vitamin C. Different brands are available. It's mostly over the counter, or you can get it from some cosmetic shopping sites like Nykaa or many Amazon like that. So it is there any benefit from that? Antioxidants can actually, it's very less harmful unless it irritates your skin. Sometimes this face serums will be oily. That oily texture will give you some kind of moisturizer to skin. So that in that way, it is a good thing. Role in decreasing the pigmentation, but again it is a topical thing which we cannot give you 100% surety that this will reduce our pigmentation, but definitely it will help to reduce at least to a bit. Like what about then salicylic acid serum? That's very common available. I would probably not recommend salicylic acid because it is just to decrease the oiliness of your skin. It is not advisable for you. So better go with vitamin C, and it's an oil-based serum. That's well and good, but it should be less irritating. And another thing, it is the collagen supplementations, collagen serums, collagen cream. And as it is a collagen depositing disease or collagen vascular disease, it's better to avoid anything which boosts the collagen, because we don't have any evidence to say this is going to activate your disease or this is going to improve your skin. We don't have any evidence. So, but in this case, it's better to avoid that. And also these serums or creams that is coming in the ads which boost the collagen, we don't have any evidence, and these are very big molecules which will have very less penetration through the skin and cause any changes in your skin. So I think probably it is not a good idea to go with any serums or cream which boost your collagen. So another main problem that I come across in clinic is skin is very much itchy or severe pruritus. So it could be of three causes mainly. One may be due to the dryness, because the skin is getting hard and not applying enough moisturizer. There is decreased oil glands in the skin. This all can cause a lot of dryness. So if you apply good amount of moisturizer twice or thrice in a day, you can tackle that situation. That's a solution. But sometimes, even if you have applied the moisturizer, but your itching is not getting subsided, and you are having some and if you are observing some redness and you feeling like that your thickening is increasing or it's progressing, then you should have a chat with your treating physician, rheumatologist. It might be that your disease is getting active. We need to treat the disease by medical management, pharmacological therapies. And sometimes some systemic causes like thyroid, when you have a low thyroid in your body, like your glands are not active, again it can cause us dryness. So we need to check how is the thyroid function. Second thing, iron deficiency. Sometimes you may have some difficulty in swallowing, as fibrosis involving the gastrointestinal tract. So you may not get enough nutrition, so it will be difficult to get all the nutrition. So in that case, iron deficiency can also cause us dryness. So just we have to look for that also. Your iron study, like you have to look for the iron studies. And when you apply moisturizer, other thing what we can do is we can take some antihistamines. Like if it is due to the dryness, if you are applying moisturizer, along with that, if it is severe incapacitating itching, which will prevent you from sleeping or it affecting your quality of life, you can take cetirizine or fexofenadine, which is antihistamines. Or so many patients, sometimes I got a few questions from Reshmi. In that, one patient was where was asking me about the scalp itching. That is very common condition that I have seen in many patients. So this again, it is the scalp area. We can apply some good oil, whatever it is available in your home, or sometimes some cream which will decreases the itching or the sensitivity of the skin, like Ducre or some physiogel kind of moisturizer. They have some specific molecule which will decreases the itching. That all things can be used for scalp itching and the body. And sometimes it is better to keep this moisturizer in fridge. That will give again this cooling effect, will give you that the coolness will give you some soothing effect to your skin and will decreases the itching. But should be very careful if you have a Raynaud's phenomenon and if you have active ulcers or you have the Raynaud's thing is going on, and they're better to wear the gloves and take this moisturizer from your fridge. Ukraine, and this is a physiogel. So another thing is red spots. So basically the red spots is the medical term is the telangiectasia. Telangiectasia, it is, everyone has blood vessels, but it's not very visible. But when it becomes dilated, that is the dilated blood vessels in the face or in the hands or the legs, that is the telangiectasia. And it is a very small blood vessels getting dilated. Sometimes, usually it's a part of the scleroderma, And sometimes if you feel like you are getting you have recently observed that there is a lots and lots of red spots are coming on my face or the hands, then you better to have a chat with your rheumatologist or your treating physician, because this might be a maybe an early predictor of the pulmonary artery hypertension or your lung problem. So if you feel like that, if it is popping up one after the another and in a very short period of time, then you can have a chat with your doctor. And what we can do for this problem is sometimes these may not very respond to the medication what we are taking, like methotrexate or MMF or whatever, the cyclophosphamide. So in such cases, what we can do is a simple thing is the camouflaging with the makeup products that will definitely just hide it. So good concealer or good foundation can help you in that case. Or if you feel like there's a lots and lots of coming and your lung is okay, but it is causing this not cosmetically aesthetic, then you could go for vascular lasers like IPL or PDL. These are vascular lasers and it is very effective in studies and the thing it cannot stop them occurring, but it can treat whatever it is in your face or your hands, whatever in your body, it can treat it, but it cannot stop them occurring. And another, it is some have this calcinosis, that's a calcium deposits. In such cases, even carbon dioxide laser also has been tried and it's showing very good results. So another thing is massaging useful? I'd say yes, it's a very good thing that we can do it even at home or while you're watching a TV or watching the YouTube or reading some books. That's a simple thing what we can do at home. We can massage our face, elbows, knees, hand. This one thing, it will just a relaxation thing, and you can do at any time, at any place, and it will just improve the mobility of the joint. Another thing, it will drain the excess fluid in the face, because sometimes when you are on steroids or like low steroids or some immunosuppressants, you might feel that your face, sometimes it is some kind of puffiness. So if you do this massaging with good moisturizer or oil, it decreases your dryness, your itching. At the same time, it definitely decreases the puffiness. So when you do the facial massaging, it is towards, this is the way how to do it, especially on the face. So you have to do it is towards the area where the lymph nodes are draining. So these lymph nodes are like a glands which is present in different parts of the body, which will drain our fluid, like extravascular, that is a fluid which is in the tissues. They drain the fluid from the tissues, and it will go to our heart. So what we can do is excessive amount of fluid, we should massage in a way to the area where the lymph nodes are draining. For the head, you can go to the upside, and to the face towards these areas, and chin to this eye, this submental, this group towards the chin. This can also be done at home. And then some people are asking about the salon procedures. We have a lot of salon procedures. So when scleroderma comes, when about the skin case, when it's happening to us, it's kind of it will affect our yes, definitely it will affect our physically and mentally. But this cosmetic appearance is again a big issue for scleroderma. So in such cases, we wanted to do something to reduce our pigmentation, to dryness. So we may go to a different like we may go to some procedures, sometimes salon procedure or cosmetic procedure. So if you are going to the salon procedures, I would suggest facial is a good thing, because it is basically they are doing the facial massage. But if they are applying some creams, if it is non-sensitizing or a non-irritating, okay, well and good. But if it's causing some irritation in your skin, you just tell no to facial. But next procedure is the bleaching. But I would say the bleaching, there is a big no to the bleaching because it contains ammonium or a bleaching agent, which might give you an instant glow or lightening to your face, but it is just only for 1 or 2 days. Again, when you expose to the sunlight or when you start working, when the skin start rejuvenating, these again can causes irritation, and it's not a good thing. So bleaching, it's better avoid. And peeling, everyone knows that the peeling is the one thing which is now available in clinics, and it is available in salons, and even you can buy it through Amazon or Flipkart or whatever it is, the online shopping. So home peels, because we don't know what is best for you. If we can see your skin and suggest, okay, this peel is good for you, like a superficial piece, like only dealing with the upper part of the skin, yes, it may be a good idea. But deep peels like cosmetic peels or tricyclic acid, TCA peels like trichloroacetic acid, these are deep peels which can affect your upper part, that is level 1 and level 2. As the skin is atrophic, it might causes burns, it might causes irritation, it can even cause post-inflammation, it can causes pigmentation. So better not to do a peel at home, or always say no to deep peels. And other procedures in salons is pedicure and manicure. And these pedicure and manicure, like they are mainly dealing with the nail. And sometimes when you have a Raynaud's phenomenon, or when you have the skin thickening, you might have some defect in your nails. So when they do the manicure or pedicure, they are just removing they are telling that they are removing the debris, but they are actually removing the connection between the proximal nail fold, that is the connection between the nail and the nail fold, that's the skin. So if they remove that part, there is a gap between the nail and the skin. So when you are exposed to washing, or when you are cooking or washing the plates or washing your dresses, you are exposed to this all the allergens like soaps or detergents, which can causes irritation, and sometimes it even can causes fungal infections, which if there's a high chance that, as you are already on immunosuppressants, there is a high chance that you can get fungal infections. And in such cases, we need to take some antifungals for this nail problems. So it's always better to avoid such pedicure, manicure, deep peels, and bleaching. Another problem is like callosities. Callosities, it is like because of the loss of fat pad from the toes, mainly in the toe areas that we can see here. This is the callosities, because the callus formation. So it is basically the skin is trying to protect that area, that bone, from getting damaged. So once you start walking, if you have a callus on your legs, once you start walking, it will cause excruciating pain. It's very, very painful condition. And if you have such problem, you better consult your dermatologist, because we have treatment for that. One thing what we can do is use a soft padded chappals or shoes, which will definitely help you to just normalize the pressure over that area, distribute the pressure. Second thing, what we can do is you can apply some salicylic acid containing cream that will be around 16 or 25%, that you can apply over that area only at night. Just moisturize all the area except that callosity, this callus area, then apply some salicylic acid cream, and you can just occlude that area with a paper plaster, but just only for 6 hours, only at night. Next day morning, you should remove that plaster, wash your leg, and just apply the moisturizer. After 15 or 16 days, the upper part, the skin starts get peeling off. Once you start seeing that, you can use the pumice stones like this. While you are taking bath, you can take this pumice stone and gently scrub that area, so that we can get rid of this callosities. Or you can use this silicone thing that is also available, that can also be useful in case of callosities. Another is the digital ulcers and fissures, that mainly it's due to the Raynaud's disease, and we need to treat the Raynaud's optimally either by the oral drugs like tadalafil or other, or sometimes we need to take IV injections. But I wanted to tell that we can try to prevent it. How? We can warm your hands and legs, wear the sweaters, gloves, and socks to make your core body temperature in a better optimum level, so it will not causes vascular constriction, that is blood vessel to constrict. And also you can use, because in North India there's winter season is there, and some extreme winter, don't try to go out in winter, and or drinking warm tea while going out in winters is also an option. Sometimes can wear this gloves, or sometimes this during winter time the skin become extreme dry and starts developing the fissures or cracks or some ulcers like that. If you don't have any pain or any pus or fever, then it is not infected. But if all these things are there, it might be infection. So in such cases, better to take a consultation with the doctor and start on antibiotics. But if it is not like that, you have completed the course of antibiotics, but the ulcers is not healing, you're already on medication. So in such cases, we can use zinc oxide paste, which is commonly available, and it will not create any antibiotic resistance. That's one thing which can use it. Another problem is that the dryness, fissure food, or the fissures that happen on the heel of the over the heel of the foot. Here we can use is the 25% Purea cream, which is also very beneficial. And another problem is the lip chapping. Use a good lip balm, regular use. You may need to use it at sometimes every hour or every 2 hours, but use it when it is winter or lip chapping. And then coming to the pigmentation, it's very difficult to tackle, because this pigmentation could be diffuse pigmentation, means it's involving all over the body, or it could be something like salt and pepper pigmentation, mainly in the upper chest area, back area, behind the ear, or in the forehead, sometimes over the scalp. This is this pigmentation, it's a consequence of the inflammation. Once the inflammation stops in your body, your skin starts getting pigmented. It's because all the inflammatory cells, it started subsiding, and what the consequence of this inflammation is the pigmentation. So in some people, like, it improves very, very, very slowly, but some it persist, but more often it persists. One thing we can do is if it's over the face, we can do some foundation or concealer like that. Or another thing, it is like a salt and pepper pigmentation, camouflaging makeup by using this derma color. I think your dermatologist can help you in that, because they will give you a sample pack of this, and you can test which one is best suits with your skin color. It might be type 4 skin, and sometimes maybe go with brown, or sometimes beige, or any different color. They will give you the sample of this, and next time when you come and visit, you can order for that same color for you, whatever is best for you. So this is one thing which is an option for, especially in the salt and pepper pigmentation, because sometimes drugs, this salt and pepper pigmentation may not respond to our immunomodulators, like immunosuppressants. This is actually one study. This is our patient. She was systemic sclerosis, and she had this resistant salt and pepper pigmentation on her chest and the back, and she was on initially she was on methotrexate, then MMF, and the disease was stable. There is no progression of skin thickening, or lung is fine, but this is very much cosmetically not acceptable for her. She is working as a receptionist. So we tried Eximer light. This is a kind of this is Eximer laser or Eximer lamp. In this, we are using light, 308 nanometer light. We are using it to give, and it is giving in a twice weekly sessions. And after 30 sessions, her actually skin near normal. She achieved near normal pigmentation. But this is only one case. We don't know. We need to do this study in. We need to try this Eximer laser in other patients and see how is it a significant response to other patients. And if it comes, then I think this would be probably a good treatment for the salt and pepper pigmentation, because which we are giving the light only on some part of the skin. Actually, this treatment is basically for vitiligo, but we just tried it in the salt and pepper pigmentation, and the patient responded very well. Another common question is cosmetic procedures. Can I do cosmetic procedure? So we have a lot of cosmetic procedures available now. Injectables, then we have like injectables like fillers. It can be synthetic or collagen fillers or fat transfers, or sometimes Botox. These are the questions that I get. So fillers, it's like it's a good option. Like when your disease is stable, you don't have any progress, you don't have any further increase in the skin thickening, or your lung is fine, your all other manifestations is in a stable position, I think this is the best stage that you can go for the cosmetic procedures like injectables, especially the fat transfer. That is useful only in inactive diseases. And the studies have shown that they have not seen any reactivation in the stable diseases, but it's only decide when you have a chat with your physician and decide, okay, am I okay to go with this cosmetic procedures? If your disease is stable, yes, this is worth trying. Maximum benefit you will get it, especially in the fat transfer. That is much more beneficial than fillers. Fillers will last only for less than 2 years, sometimes around 12 to 18 months. But fat transfer, which is your own fat is transferring, that is autologous fat transfer, or sometimes micro fat transfer, which is usually done by a plastic surgeon, which is much more beneficial than the fillers, but it is quite expensive. And if you wanted to do it, but you do it only after having a chat with your treating physician. And maximum benefit, you will get it in the cheek and around the mouth, and less over the chin area. Not like the normal skin, you might need maybe 2 or 3 sessions, and we may need to correct it over the time, because with one session you may not get complete correction of the face, but you may need it around 2 to 3 times, sometimes even 5 times, 5 sessions needed. And there will be improvement in the mouth opening, that the pain, and also the cosmetic appearance. This is a condition that's a linear scleroderma. That is mainly the patient. This patient has actually loss of fat and over the fat, and the sclerosis over the forehead area, where they have done the autologous fat. That's patient own fat, and got the very good improvement. And you can here also see that the patient mouth opening has improved, and is aesthetically better. Next is the fillers. Fillers, like if you don't want to go for the expensive procedures like fat transfer, then fillers is again is an affordable, but it costs around 10 to 15. Again, whatever the procedure is there, better to have a chat with your doctor, treating doctor, to see that your disease is stable. We may need multiple sessions, again 1 or 2 sessions. Even with you are an immunosuppressant, if the disease is stable, can consider this procedure, because the evidence is showing that it's a good thing to go when the disease is stable. And the different types of fillers are there. More extensive or more extensively studied was hyaluronic acid fillers. What their fillers is doing, they are just restoring the volume, because you lost a lot of volume over the face, like over the cheek area, chin area, sometimes over the over perioral area. When you inject this hyaluronic acid into the lip area or the cheek area, this will forms like a gel, and it will hold the water, and it will restore the volume. But again, we are not sure that like how long it will last. Sometimes is in the normal case it will last around 18 months, but sometimes in scleroderma cases it might may last only sometimes up to 12 months. Next is the again, another question is the Botox. I don't think so Botox is needed, because Botox is basically to decrease the tension. Because if you have a wrinkles like extensive wrinkles like nasolabial fold, that's wrinkles over your mouth, or in this from the ankle of mouth we have some wrinkles. So in such cases the muscle is overactive, or some crow feet like around the eyes. In such cases Botox is useful, but already this is very, very tight. So I don't think so Botox is a good idea for scleroderma. But definitely if you are disease unstable, you can consider fillers or the fat transfer for the lip and the cheek area, and it will definitely improve the opening of the mouth and aesthetic outcome. These are the fillers. Actually, these are the pictures. They have injected fillers into the mouth, and this is aesthetically better and can open their mouth. And on the right side, can see that there's a definitively volume loss over the cheek, where they have applied, where they have given this fillers, hyaluronic acid fillers, and the patient having got the good volume of the fat. And another thing, if you have like a lot of ulcers, and you lost a lot of tissue loss. In such cases, if you the plastic surgeon can help with the skin and cartilage graft or tissue expanders, flaps. These all are coming up. Maybe over the time, these can change the appearance, and this can definitely help to restore that whatever the tissue has been lost. But every time before going a procedure, whatever the procedure it is, better to have a chat with your treating physician, and he can or she can guide you well. So thank you so much. I hope this will help you.